Hey guys, so I'm here in the hyperbaric chamber. So this kind of spacious thing here. I've got my monitor, so at any point I can see the pressures and the timing. And you might imagine that it's going to be a little scary. It isn't, but just for people who are a little bit scared, they may understand that at any point there's like an emergency shut off button, which I shouldn't need. So the thing about a chamber this as big as this, and I'm going to just turn the camera around so you can see, well, can you, is that, you know, if you look around, it's quite a big chamber. And that's the door that I came in on, right? And so it's a pretty capacious thing. And if you look at it, I mean, look, I'm sitting on like a double-seater. It's like being in an airplane, right? You know, you could just imagine you're here. So plenty of space. And the thing is that the pressure gets built up slowly. It's like going up on a plane. And so that as you feel your ears clicking, then what you want to do is swallow. So either swallow or yawn, have maybe a, you know, look at this, there's even a cup holder here, you know, have a glass of water so you can sip at it. So what better than sort of, you know, having your beverage, watching a little bit of TV, or you know, why not watch Dr. Habib? You know, that's the best kind of entertainment. And just a joke there. So you know what, you know, this is a great way to really activate the cellular function at the mitochondrial level. I mean, it is amazing. So what I plan to do on a different occasion, explain to you that if I can do some of my therapies that I do outside, meaning in the regular exam room, and I can do it under pressure inside whilst you're getting the hyperbaric chamber, it's going to be synergistic. It's going to be amazing. But let's just talk about the hyperbaric. The hyperbaric at above 1.5 psi, at 1.5 ATA, atmospheric pressure, is very therapeutic. It detoxifies the mitochondria. It activates the antioxidant function. It increases the oxygen level in the tissue. In fact, that's why the hyperbaric was utilized from the medical perspective to deal with wounds that weren't healing, to deal with chronic infections that were difficult to get hold of. Because two things are necessary for healing, whether it's wounds or infection: blood flow and oxygen. So the hyperbaric probably does both, but for sure it delivers oxygen under pressure. But the amazing thing is, what we found is that that creates an oxidative stress temporarily during the period of the hyperbaric, and after the treatment, that's when the body's antioxidant system gets engaged. So that system, activation of the antioxidant system within your body, stays engaged for a long period of time, maybe even days. So not only can you boost the immune system by engaging that immune system, by activating the immune system, I should say, you also get oxygenation at a deeper level from down to your every cellular structure. So your brain, your heart, your liver, the fat. So at the cellular level, that's why we talk about mitochondrial detoxification. So what's happening is that you are now engaging the mitochondria, bringing it to life. Not only because of oxygenation, not only because you've activated antioxidant function. I have to swallow because my ears are plugging up, so the words are hard. So the three levels: oxygenation, activation of the antioxidant function, mitochondrial detoxification, and you know, for standard reasons, it helps with wound healing. For standard reasons, it helps with chronic infection. That's the obvious stuff. But if you have, you know, molecular or microscopic infection, which we know comes from lipopolysaccharides, if you have leaky gut, where toxins around the bacteria are now entering the bloodstream, and they can travel everywhere. They can travel to the brain, they can travel to the heart. That's possibly how, when you have, you know, disease, there is a bacterial imbalance at those organ levels. We don't just have bacteria in the colon. We don't just have bacteria in the small intestine. We actually have bacteria in the brain and the breast tissue and the heart and the blood vessels. It's in a kind of a balance that we never understood. So when you have an imbalance because you have a breach in the system, like the breach in the gut system allows these lipopolysaccharides, then you have an immune system that supposedly able to deal with it. But what happens is that when you bombard the body with multiple problems like high sugar levels, having a high blood pressure, having a sedentary lifestyle, having inflammation around your body, you're stopping the body from being able to do its job. So you have an imbalance in this exposure, and this is the mechanism where you can get global help. That's why I said that I would use this in addition to my other therapeutic modalities, whether it's for brain function, heart function, blood vessel function, immune function, gut function, liver detoxification. It will be synergistic if I combine it, because this hyperbaric works at every level. So very importantly, just from a macroscopic point of view, meaning an obvious point of view, you can increase blood flow to the brain. Tell me a condition where that is not benefited, right? So almost everything where it's neurological, whether it's insomnia or depression or anxiety, or after you've had a stroke or traumatic brain injury, you have decreased blood flow. We know this because it's in the literature. We know this because we actually do EEG type of functional scans of the brain. And so it's going to be exciting to not only put more people through this program, incorporating the hyperbaric, but we'll get the baseline of their blood flow and the voltage and the brain function. We'll get the baseline of their, you can't get the mitochondrial function directly, but indirectly we can look at metabolism. We can look at how the body is able to keep inflammation, oxidation down, or look at the baseline. And then once we engage in the program, evidence-based medicine dictates that we must monitor those metrics again. And for sure, based on knowledge we already have, it's going to work, but this is at a new level. When I said that this is a chamber, it's not easy to find a chamber this big. And in fact, we can add modules to make it bigger, to get a whole family in there. This is really designed to make it comfortable so that you're not claustrophobic. And look, what I'm feeling now is like going up on a plane. So if you explain that to patients or clients, then they understand. So I can feel it on my left side more than the right. I used to have a lot of allergies. That would be very difficult to be in here. So we would give people advice that if you have allergies, or you have some sinus infection going on, or there's a lot of congestion, or some underlying things, which of course as a physician we would be able to find out any contraindications, but really for most people it's going to be just about symptomatic, right? So if you explain to them that when you have a gulp and you swallow, this ear just opened up completely, this one is still a little bit blocked, but as you know, when you go up on the plane, these things happen and then eventually they level off. So as I'm going from 1 atmosphere, 1.3 atmospheres, ATA, 1.5, 1.75 up to 2, that is very therapeutic. That's medical grade, right? That's medical grade. And in medicine, more is not always better. But in this situation, what we're really doing is not only short-term oxygenating the body, short-term helping the wounds and the infections get better and increasing the blood flow in a macroscopic way, but in the long term, we're activating the antioxidant, which is the immune function. So this is going to be an amazing thing to do.